Hi everyone, welcome back for the new presentation on dengue. I am Beulah Dallas, HOD of Community Health Nursing Department, Trippuram College of Nursing. The objectives of today's sessions: the meaning of dengue fever and the epidemiology of dengue, signs and symptoms of dengue and the preventive measures of dengue. The epidemiology of dengue is it's an endemic disease. More than 110 countries were affected by this dengue fever. It infects 50 to 100 million populations worldwide in a year, leading to 500,000 hospitalizations and approximately 12,500 to 25,000 deaths due to this dengue infection. The death rate due to dengue is 1 to 5% without treatment, but less than 1% with adequate treatment. That death is happening. Severe dengue carries a mortality of 26%. The agent of this dengue fever is caused by RNA group of virus of the family of Flaviviridae, genus Flavivirus. The most are transmitted by the arthropods, that is the Aedes mosquitoes. It is otherwise called arthropod-borne viruses. The characteristics of Aedes mosquitoes are: it's the humans or the primary host of the virus. Also circulate in non-human primate. They bite primarily during the daytime. Can be acquired via single bite. It will be lives in a drinking water, that is clean water. Transmission of this dengue fever: the mosquito that takes a blood meal from a person infected with dengue fever, and it becomes infected with the virus in the cells lining its guts of that mosquito. About 8 to 10 days later, the virus spreads to other tissues including the mosquito's salivary glands and is subsequently released into its saliva. When it bites a person, this virus enters into the skin along with the mosquito saliva, then enter into white blood cells and the reproduces inside the cells of the human being. Now the human being will be the host or the case. The signs and symptoms of dengue fever: sudden onset of fever, high grade of fever, headache. Typically, it's located behind the eyes. The people often complaining about having eye pain. So muscles and joint pain, and also rashes over the body. This alternative name of dengue is called break bone fever because it is affected mostly the muscle and joint. It is the patients will complain of severe muscle and joint pain. That's why it is called break bone fever. Skin rashes that is similar to the measles. The dengue hemorrhage fever resulting in bleeding, low levels of blood platelets. It's a very dangerous one. So we have to replace it with a platelet therapy. The warning signs of dengue were ongoing vomiting, abdominal pain, liver enlargement, mucosal bleeding, high hematocrit with low platelets, lethargy. The management of dengue fever. For the first thing is fever management. We have to promote hydration of the patients. You have to follow the standing order of tablet paracetamol. It is necessary we can give, and watch for warning signs and seek the medical help. If the warning signs or any emergency symptoms you find, immediately we have to seek the medical help. How we can prevent this dengue infections? First, keep the empty containers in upside down. So that is already I told that this mosquito will be living in a clean water. So better we can keep upside down all the containers, shoes, and this we have to remove all the coconut shells and broken plastic buckets like that. Use insecticides, biological control agents. Example, we can grow the kombucha fish in the pond or in our well, like that. So simply call it as guppy fish. The environmental modification: wearing the fully long sleeved shirts or long pants, socks and shoes when in outdoors, using mosquito netting while resting, application of insect repellent. So if you are using all those things, we can prevent the bite of mosquito. And the very best method is we have to avoid the mosquito breeding sites. So first we have to eliminate all the stagnant water that serves as a mosquito breeding sites at home and the workplaces. So cover overhead tank to prevent the access to mosquitoes. Eliminate breeding ground by removing unused plastic pools, old tires or buckets, and clearing clogged gutters. Awareness program is very important. We have to create awareness to prevent this mosquito breeding sites and the prevention of dengue among the public. It's very important. So let's summarize this session. So till now we have discussed about the meaning of dengue and the causative agent of dengue fever, mode of transmission, signs and symptoms, management, and the preventive measures of mosquito breeding and the prevention of dengue. Let me conclude this topic. Dengue is endemic in more than 110 countries. It infects 5200 million populations worldwide in a year, leading a 500,000 hospitalization due to this dengue fever. Approximately 12,500 to 25,000 deaths happen due to this dengue fever. So prevention is better than cure. So better to prevent mosquito breeding sites in and around our environment. Thank you for your patient listening.